Assalamualaikum. My name is Nurul Stabeti Razali, and today I would like to talk about pandemic COVID-19. A pandemic is the worldwide spread of new disease. An influenza pandemic occurs when a new influenza virus emerges and spread around the world, and most people do not have immunity. Viruses that have caused past pandemic typically originate from animal influenza viruses. On January 8, 2020, a precise scientific article was submitted for publication to the Journal of Travel Medicine on a pneumonia of unknown etiology that was identified in patients in Wuhan, China, and the potential for its international spread through commercial air travel. The World Health Organization reported 44 patients with pneumonia from Wuhan City, Hubei Province, China. On January 2020, the pathogen causes this form of pneumonia was identified as the newest member of the coronavirus family. Confirmed to cause disease in human, clinically epidemiological studies and characterization of affected patients soon followed. For prior to the identification of this new virus, there were 6 non-human coronavirus, of which 4 caused only minor cold-like symptoms, but other 2 caused more serious illness, which is severe acute respiratory syndrome coronavirus SARS-CoV and Middle East respiratory syndrome coronavirus MERS-CoV. In the relative short time span of 3 months since the new coronavirus was identified, the literature on COVID-19 has grown exponentially from not a single scientific report to over 1,600 publications across numerous disciplines in the field of medicine, including infectious disease, virology, epidemiology, immunology, critical care medicine, pediatrics, medical education, psychiatry, and surgery. Just now, neurosurgical programs from Wuhan, China, are submitting articles to the journal describing their experience combating COVID-19 in their hospitals. According to this report, endoscopic endonasal skull-based procedures should be avoided as much as possible given the high likelihood of aerosolizing virus particles with the nasal sinus and infectious operation room staff. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Mariam Madati binti Ramli. Today I'm going to show you the number cases in Malaysia. As we analyze the number of cases, this is the total numbers for COVID-19 cases in Malaysia. As it stated in the statistics, it shows the total number of cases totally increased by time to time. We can see every day the number of death and the number of affected for coronavirus is increasing. The number for coronavirus cases is 144,518. For the death cases is 563. And lastly, for the recovered cases is 111,578. It shows the coronavirus cases is more than the recovered cases. So, as a Malaysian citizen, we must have a strong desire to break this chain to protect our country. That's all from me. Thank you.
Hello, my name is Muhammad Amir Zakwan. As we can see in the statistic, the percentage of people who are affected at the COVID-19 are increasing from time to time. So we can conclude that people around us are still stubborn about violating the SOP rule during this pandemic. The cost of the pandemic increased due to the lack of awareness of individual responsibility. Each individual has an important role to play in effort to control the spread of this pandemic. Awareness of responsibility and self-discipline that every individual in our society must have a high level of self-discipline. Each individual play an important role in effort to control the spread of this pandemic. Awareness of responsibility and self-discipline that high need to be possessed by every individual in our society is a mover key community adhere to the rule standard operating procedure SOP that have been provided by the administrator. However, our society does not take this seriously and still violating the SOP rule. As an example, there are still a handful individuals who are refused to wear the face mask even though they understand it is important the effort prevent this COVID-19 infection. This is the main cause of our failure to decide the break the chain of COVID-19 infection in Malaysia. That's all for me. Thank you.
Assalamualaikum. My name is Nina Amira and I will be presenting on a solution for COVID-19 pandemic using artificial intelligence and the overall conclusion of this video.
Solution for COVID-19 pandemic using artificial intelligence. In this worldwide health crisis, the medical industry is looking for new technologies to monitor and control the spread of COVID-19 coronavirus pandemic. AI is one of such technology which can easily track the spread of this virus, identifies the high risk of patients, and is useful in controlling this infection in real time. It can also predict mortality risks by adequately analyzing the previous data of patients. AI can help us to fight this virus by population screening, medical help, notification, and suggestions about the infection control. This technology has the potential to improve the planning, treatment, and reported outcomes of COVID-19 patients. Being an evidence, the picture beside me shows the general procedure of AI and non-AI based applications that help general physicians to identify the COVID-19 symptom. The flow diagram informs and compares the flow of minimal non-AI treatment versus AI-based treatment. The flow diagram explains the involvement of AI in significant steps of treatment of high accuracy and reduces complexity and time taken. The physician is not only focused on the treatment of the patient but also the control of disease with the AI application. Major symptoms and test analysis are done with the help of AI with the highest of accuracy. It also shows it reduces the total number of steps taken in the whole process, making it more procurable in nature.
In conclusion, artificial intelligence (AI) is a useful tool that can be used to detect early symptoms of COVID-19. It also can keep track of the condition of all the infected patients. The number of doctors and nurses who have a high chance of getting infected will be reduced. Doctors from all around the world can keep track of new symptoms that can be detected when a person is affected. AI also acts as a virtual assistant and chatbots to the public.